Okay, last speaker is Jason Bellet, co-founder of Ekkos. Jason, come on onto the stage. So Jason is going to tell us another one that we're taking a traditional area and adding AI and revolutionizing it. So Jason, we're really eager to hear about it.
Thank you. Well, medicine, thank you. I'm so impressed by that last presentation, and obviously farming is way older than the stethoscope, but the stethoscope's been around since 1816. So I want to take you on a little bit of journey through our work bringing the stethoscope into the digital age. I'm one of the co-founders of Ekkos and a board member, and then also give you a glimpse into the future of cardiovascular health. So while heart disease, as many of us unfortunately know too well, is the #1 killer in the world, many of us may also be surprised to find out that despite all of the innovation in healthcare, specifically in cardiology over the last 50, 100, even 200 years, the tool that healthcare providers, 30 million physicians around the world, rely on as the frontline screening tool for cardiovascular disease is still the stethoscope, which is a rubber tube with a metal chest piece. And so it begs the question, why is the stethoscope, after 200 years, still such a popular tool on the front lines of care? Well, its power comes in its simplicity. It's easy to use, it can be integrated into a physical exam in under a minute, and it's actually very, very low cost. But one of the unfortunate parts about the stethoscope is that it's incredibly reliant on the subjectivity of the human ear. So I want to take you a little bit back in time to about a decade ago, across the bay at UC Berkeley. My co-founder was doing his senior thesis on medical innovation and was talking to cardiologists specifically about the stethoscope and how it's so reliant on the subjectivity of the human ear and the risk of missing a murmur on the front lines of care. And the cardiologist put it into perspective. If we can improve the ability of a clinician to detect early signs of heart disease in a primary care exam before they get to cardiology, we could dramatically improve patient outcomes and help millions of patients live longer, healthier lives. And there was sort of the quintessential, stereotypical light bulb moment that my co-founder had, which was, what if we could build the Shazam for heart sounds? What if we could take what Shazam did for music, allow any of us to Shazam that song that's on the tip of our tongue in a crowded Walmart, and put that in a stethoscope, and allow any clinician, when they're listening to a heart sound, to identify that hard-to-hear murmur. Because if we could do that, we could help clinicians all around the world more accurately detect disease so that patients could get the downstream specialty services that they needed. And so the mission for Ekkos was really born out of this conversation. And the mission wasn't just to build the Shazam for heart disease or for heart sounds. It was to elevate the way that we screen for cardiac and pulmonary disease on the front lines of care here in the US and around the world. And so for the last decade, this is what we've been working on, really actualizing this mission. And I'm so proud of our team for rising to the challenge. We not only revolutionized the stethoscope, we supercharged it. And we've made it a powerful early detection tool for cardiopulmonary disease. You can think about our platform as having 3 major components. First, we have our devices and our sensors. We have 3 flavors of our stethoscope. One is actually an attachment that a clinician can clip on to their existing analog stethoscope. So we wanted to let clinicians keep the stethoscope they already owned and loved, but bring it into the digital age. We have a collaboration with 3M. 3M actually owns a brand called Littmann, which is the largest analog stethoscope company in the world, and we partnered with them to bring the Littmann line into the digital age as well and equip 3M with Ekkos technology to create the 3M Littmann stethoscope. And what I'm wearing today is our latest and greatest. It's called our Core 500. And I'm going to give you a sneak preview of what it has in store, and outside you'll get a chance to listen to it for yourself. But with all of these devices, we wanted to do more than just amplify heart sounds. We wanted to give providers a 360 view of both structural and electrical health of the heart. So Ekkos is actually the first company to build in an ECG into the stethoscope and bring it to the mass market, really allowing providers to get a 360 sense of the heart in seconds. The second part of our platform is our AI. So now that we've digitized heart sounds and lung sounds for the first time in history, imagine what we can do with them. And we've built algorithms and received FDA clearance on algorithms that can screen for a couple of very important conditions. The first is structural heart disease. The second is atrial fibrillation. And we have an FDA breakthrough indication and expect to launch in 2024, pending clearance, a heart failure screening algorithm. So the future of your primary care exam is that your provider puts a stethoscope on your chest and in 30 seconds can screen you for structural heart disease, AFib, and heart failure with the help of AI, and a host of other conditions with the amplification, noise reduction, and other benefits of a digital stethoscope. The third component of the platform is now that we've captured the data, we've analyzed it, it's how do we make it play nicely with the other tools the system has in place. And so we've built an analytics dashboard and electronic health record integrations to make sure that your heart sounds and your lung sounds become part of your health record forever. So I want to take a moment and we're at the Computer History Museum, give you an update on where we are since we started this company. We just crossed 400,000 digital stethoscopes deployed in the US, and we're now starting to expand to Europe. And this really represents one of the largest communities of healthcare professionals using AI-enabled connected medical devices in a primary care setting, and we're incredibly proud of that. I also want to share a couple key accomplishments that the team has been able to do. We have over 40 clinical validation and real-world evidence studies that we've completed. We pioneered really the first mobile-enabled structural heart disease platform, have 36 issued and pending patents, and one of the things we're most proud of is building the world's largest heart and lung sound database of almost 3.5 million digital heart and lung sounds that can be used to train even new algorithms and new diseases that we can screen for. I also want to take a quick moment and highlight our latest Core 500, which received FDA clearance in June. If you can make a stethoscope sexy, I think we accomplished it with this product. I'm a bit biased. But this product has active noise cancellation. It allows a provider to actually get an alert on the stethoscope itself if the AI flags a condition. It has the embedded 3-lead EKG and a full color display. And of course, this conference has the show me motto, so come by our booth and let us show you. Want to take a minute as well and thank Infineon for having us and also just being such a great partner over the last 10 years. The PSOC 6, which is built into the Core 500 and actually our Littmann Core product as well, helps ensure our device's performance and its precision. The dual core architecture and the high-end ADCs help make our readings swift and accurate and create a user experience that's intuitive in really any medical environment. So as I wrap up here, as the entrepreneurs and everyone in this room knows, this is only possible with our incredible team. So I want to thank the Ekkos team that's here today for your hard work and your dedication to our mission. I want to thank the Infineon team and this ecosystem for being a force multiplier and bringing our vision and mission to build an AI-enabled stethoscope into reality over the last decade. And I just want to thank everyone and take a moment to realize this light bulb moment at UC Berkeley 10 years ago to develop the Shazam for heartbeats is now very much reality, and that's due to this partnership. So thank you.